Hello and welcome to Care Conversations, brought to you by Nurse Registry. This is your trusted space for straightforward and useful health topics that matter the most to you and your family. From managing chronic conditions to understanding what quality nursing care really looks like, we're here to empower you with knowledge that makes a difference. I'm glad you're here. Let's get started. Today, we're going to talk about something that affects almost everyone in our fast-paced, high-pressure world: stress. Now, I know you might be thinking, great, another podcast telling me stress is bad for me. And yes, we all know stress doesn't feel good, but here's what a lot of people don't realize. Chronic stress isn't just uncomfortable or exhausting, it can actually cause a stroke. That's not an exaggeration or a scare tactic, it's science. If you're constantly feeling overwhelmed, if you're losing sleep over work deadlines, or you're watching a loved one struggle under mounting pressure, this episode is for you. Because the connection between stress and stroke is real, it's measurable, and most importantly, you can do something about it. Today, we're going to explore exactly how stress physically changes your cardiovascular system, who's most at risk, what warning signs to watch for, and practical evidence-based strategies to protect yourself and your family. So let's all take a deep breath and dive in. Let me start with some numbers that might surprise you. Research shows that individuals experiencing prolonged psychological stress face a 22% higher risk of stroke compared to those in low-stress environments. That's not a small increase. We're talking about more than 1/5 higher risk just from stress alone. And when scientists examined data from over 138,000 participants across multiple studies, they found something really interesting. It wasn't just any stress that increased stroke risk. It was a very specific kind. High demand, low control work environments showed the highest stroke rates. Think about jobs like nurses' aides, wait staff, or assembly line workers, positions where you have enormous pressure and responsibility, but very little control over your schedule, your workload, or your working conditions. That combination is toxic for your cardiovascular system. Now, here's what's important to understand, though. We're not talking about correlation here. We're talking about causation through identifiable biological mechanisms. This isn't just stress people happen to have more strokes. It's stress directly causes physiological changes that lead to strokes. And we're not talking about occasional stress from traffic jams or a minor disagreement with a loved one. Those are annoying, sure, but they're not dangerous. The real danger lies in chronic, unrelenting pressure that keeps your stress response system constantly activated, day after day, week after week, month after month. That's when stress becomes a genuine threat to your brain health. Okay, so let's talk about what's actually happening inside your body when you're chronically stressed. When your brain perceives a threat, whether it's an impossible deadline, financial pressure, or the burden of caregiving, your hypothalamus immediately activates something called the autonomic nervous system. This is your body's ancient survival mechanism. It's the same system that essentially helped our ancestors run from predators. The problem? It's devastating when triggered continuously by modern stressors. Okay, here's what happens. Your body releases cortisol, which is your primary stress hormone. Cortisol forces your body to retain sodium and water, which directly elevates your blood pressure. At the same time, you're getting the surge of adrenaline, which constricts your blood vessels and accelerates your heart rate. Together, these create what I think of as like a perfect storm for vascular damage. And here's the scary part. These aren't temporary changes. Chronic stress literally remodels your arteries. It makes them stiffer, more prone to inflammation, and vulnerable to plaque buildup. Your blood vessels are actually being damaged at a structural level. But it gets worse. Stress hormones alter your blood chemistry itself. They change how your platelets function, making your blood more likely to form dangerous clots. They increase insulin resistance and disrupt how your body processes cholesterol, which accelerates the process that narrows the arteries feeding your brain. Think of it like this: stress is slowly turning your cardiovascular system into a ticking time bomb. And perhaps most insidiously, stress creates this negative feedback loop. When you're stressed, you sleep poorly. You eat emotionally, usually grabbing something quick and very likely processed and unhealthy. You stop exercising because you're too exhausted, or maybe you just don't have time because you're so busy. All of these behaviors and actions compound the direct physiological damage that stress is already causing. Your brain's delicate blood vessels, already strained by elevated pressure and inflammation, become increasingly vulnerable to blockage or rupture. And that leads us to strokes. So, what kind of strokes are we talking about here? The most common stress-related stroke is called an ischemic stroke. These are caused by blood clots blocking arteries in your brain, and they account for about 85% of all strokes. And here's how stress contributes. Chronic stress makes your blood stickier, more prone to forming clots, like we mentioned earlier. And stress promotes the buildup of cholesterol plaques in your arteries. When you're under this constant pressure, inflammatory markers flood your bloodstream, making these plaques unstable. Think of it like a scab that just keeps getting picked at. Eventually, it's going to rupture. And when a plaque in your brain's arteries ruptures, it releases clotting factors that can immediately block blood flow to critical brain regions. And then there are hemorrhagic strokes, which are less common but equally serious. These occur when a blood vessel in your brain actually ruptures. And here's something fascinating but terrifying. We've seen documented cases where intense emotional crises, such as severe grief, rage, or panic attacks, trigger blood pressure spikes powerful enough to rupture weakened cerebral blood vessels. This phenomenon is sometimes called broken heart syndrome, and it demonstrates how emotional stress can have immediate, life-threatening consequences. There's also something called transient ischemic attack, or TIA. You might have heard of these called mini strokes. These are temporary interruptions of blood flow to your brain. They typically last minutes to maybe hours and resolve completely, which leads a lot of people to dismiss them, just thinking, oh, it felt weird for a few minutes there, but I'm actually fine now. But here's the thing. TIAs are warning signs. They frequently precede full strokes, especially in individuals experiencing chronic stress who haven't addressed their underlying risk factors. Never ignore a TIA. It's your body's way of saying, hey, something is seriously wrong here and we need to get it fixed before something worse happens. Now let's talk about who's most vulnerable to stress-related strokes, because some groups do face a higher risk than others. First, young adults between 25 and 45. Now, this might actually surprise you because I think we all tend to think of strokes as something that happens to older folks. But we're seeing more and more early onset strokes in this demographic. The combination of demanding careers, crippling student loan debt, relationship stress, sleep deprivation, and inadequate self-care, it just creates this perfect storm. Many of these young people don't have traditional risk factors like diabetes or heart disease. Stress is the primary culprit. Women and men experience stress-related strokes differently, which is really important to understand. Women are more likely to have non-traditional stroke symptoms. Instead of the classic signs, which we'll talk about in a minute here, they might experience generalized weakness, fatigue, disorientation, or mental status changes. And they're more likely to delay seeking treatment because their symptoms seem a little less dramatic. Men tend to experience more classic presentations, but they often underestimate stress as a legitimate health threat. Cultural expectations of toughing it out or handling the pressure independently, that all prevents a lot of men from recognizing when stress levels become dangerous. They're also more likely to cope with stress through potentially harmful behaviors like drinking or smoking. Elderly individuals face compounded vulnerability. Their blood vessels are already aging, they often have multiple health conditions, and they face social stressors like bereavement, isolation, and financial concerns. Their reduced physiological resilience means that their moderate stress can have serious consequences. And then there's socioeconomic factors, which we really need to talk about. Lower income individuals face multiple chronic stressors simultaneously: financial instability, unsafe housing, food insecurity, limited healthcare access. These aren't just normal inconveniences, they're sustained stress that's incredibly difficult to manage without resources. If you're worried about paying rent or even putting food on the table, that stress isn't just psychological, it's a daily threat to your cardiovascular health. All right, so how do you know when stress has become dangerous? What should you be looking for? Physical symptoms of dangerous stress levels include rapid weight gain, persistent fatigue, mood changes, and sleep disturbances. Here's a really telling sign: rapid midsection weight gain. If you've gained 15 to 20 pounds in a month without really any significant lifestyle changes, your cortisol levels may be dangerously elevated. This stress belly, as they call it, isn't just cosmetic. It's a visible marker of hormonal chaos affecting your entire cardiovascular system. Behavioral changes are another red flag. We should be concerned when you're drinking more alcohol, smoking more, or relying on substances to manage daily pressure. Similarly, if you're avoiding social connections, skipping meals, or overeating dramatically, and just finding no joy in your daily activities that you used to love, your stress response system may be dysregulated. Now, let's talk about recognizing an actual stroke, because time is critical. You need to know the FAST acronym. That's FAST. Let's start with F. F stands for face drooping. Ask the person to smile. Does one side of their face droop a little bit? A is for arm weakness. Ask them to raise both arms. Does one arm drift downward? S is for speech difficulty. Ask them to repeat a simple phrase. Is there any slurring in their speech, or does it sound strange? T is for time to call 911. If you see any of these signs, note the time that they started and call emergency services immediately. Every minute counts during a stroke. We're talking about your brain here. We're talking about their brain here. The faster someone gets treatment, the better their chances of recovery. Now, remember earlier when I mentioned that women experience different symptoms? They may have severe sudden headaches, nausea, vomiting, dizziness, or confusion without obvious weakness or speech problems. They might have unexplained fatigue or difficulty understanding things. These symptoms are just as serious, even if they don't fit in the classic FAST pattern. And again, don't ignore the mini strokes or the TIAs, even if the symptoms quickly resolve themselves. If you experience sudden weakness, numbness, vision changes, or confusion, even briefly, please seek immediate medical evaluation. These episodes might only last minutes, but they indicate your brain's blood supply is compromised. Okay, we've talked about all the scary stuff. Now let's talk about solutions, and we have some real evidence-based strategies that can significantly reduce your risk. First, immediate stress reduction techniques. Deep breathing exercises, when practiced consistently, can activate your parasympathetic nervous system and counter that chronic stress response that we mentioned. Try the 4-7-8 technique. Inhale for 4 counts, hold your breath for 7 counts, and then exhale for 8 counts. 4-7-8. This simple practice can lower your blood pressure and heart rate in real time. And the beauty of it, you can do it anywhere, at your desk, in your car, lying in bed, anywhere. Meditation and mindfulness practices show significant cardiovascular benefits in controlled studies. Even 10 to 15 minutes daily of focused meditation can reduce inflammatory markers, improve blood vessel function, and enhance your emotional regulation. There are apps you can check out like Headspace or Calm that can help guide beginners. But here's the key: consistency matters more than duration. It's better to do 10 minutes every single day than to go all out and do an hour once a week. Also, physical exercise serves as both immediate stress relief and long term cardiovascular protection. Aerobic activities like brisk walking, swimming, or cycling 150 minutes weekly, which is about 30 minutes 5 days a week, can reduce stroke risk up to 25%. Exercise literally burns off stress hormones while strengthening your heart and improving blood flow to your brain. If you happen to work in a high-pressure environment, strategic workplace stress management becomes essential. Here are some evidence-based approaches. Take micro breaks. Every hour, take 2 to 3 minutes to reset your stress response. Stand up, stretch, look away from your screen, just breathe. Obviously, given your job or your position, that might not always be available to you, but when possible, those micro breaks are huge. You can practice task prioritization. Focus on one priority at a time rather than trying to juggle everything and multitask. Multitasking actually increases stress and decreases efficiency. Set boundaries. Establish clear limits on work communications after hours. Leave those emails unread. Your brain needs time to recover. Build social support at work. Relationships with colleagues who can provide perspective and assistance makes a huge difference. And here's something people often overlook: sleep hygiene. No, I'm not asking you to multitask and sleep while bathing. Poor sleep amplifies stress hormones and impairs your body's ability to recover from daily pressures. Truly, you need 7 to 9 hours of sleep nightly, no matter what. Maintain consistent sleep schedules, even on the weekends. Create calming bedtime routines that help you transition from the daily stress to restorative sleep. Now, lifestyle changes are critical, but you also need to work with your healthcare provider, especially if you're experiencing chronic stress. Regular blood pressure monitoring is essential because hypertension often develops silently. You can even get a home blood pressure cuff and track your readings daily. Your target should be below 130 and over 80, with even lower goals if you're high risk. Your doctor may also recommend stress-related biomarker testing. This includes measuring cortisol levels, inflammatory markers, and lipid profiles to assess how stress is affecting your body's systems. These tests provide objective data that can help guide treatment. And sometimes medication becomes necessary when lifestyle changes alone can't control stress-related risk factors. Blood pressure medications, cholesterol-lowering drugs, or even short-term anxiety medications might be appropriate. Don't view medication as a failure. It's often a critical bridge to long-term health while you develop sustainable stress management strategies. If someone in your life has suffered a stroke, hiring a home nurse, like from Nurse Registry, can actually help both medical care and assist them with their everyday life tasks. Let me wrap this up with some immediate next steps that you can take. Start this week, not next month, not when things calm down. Start this week. Establish one daily stress reduction practice. It could be a 10-minute walk, it could be a brief meditation, or just turn your phone off an hour before bed. These little things help, they matter. Schedule a comprehensive health evaluation if you haven't had one recently. Don't wait for the symptoms to appear. Be proactive, not reactive. Prevention is exponentially more effective than treatment after the damage occurs. Focus on building resilience rather than just managing stress. Develop sustainable exercise routines. Nurture supportive relationships. Find hobbies that bring you joy and pursue them. Here's the truth: your health is worth protecting. Understanding the stress-stroke connection empowers you to take control. Whether you're managing your own stress or you're supporting a loved one, remember, small, consistent changes can have profound impacts on cardiovascular health. Don't let stress steal your future. Take action today to protect your brain, and your life. Thank you for spending time with me today on Care Conversations. I hope this episode gave you valuable insights and practical takeaways that you can use. If you found this helpful, please subscribe and share it with someone who might benefit. Remember, quality care starts with quality information. And whether you're managing your own health or caring for a family member, you don't have to navigate alone. For more resources and expert nursing care, visit nurseregistry.com. But thank you so much for listening, and until next time, take care.